Now, sympathetic pharmacology. So chances are, if you end up in the clinic, you are hopefully not as a patient, but when you're a healthcare practitioner, you're probably going to use some sort of sympathetic drug. So sympathomimetic drugs. So mimetic, well, think of that thing. If you know like those French, like you've probably heard of mimes, right? So they're those French clowns that paint their face white and they imitate like they're doing something, like when they put that ball, like put themselves in a box. So they're acting like they're doing something. So sympathomimetic drugs, they're acting like the sympathetic nervous system. So they're not actually having, so they can cause sympathetic nervous system like effects, even if you're not actually experiencing a sympathetic stimuli. So what we have here are adrenergic receptor agonists. So these are drugs that can act like, again, epinephrine and norepinephrine. So these activate adrenergic receptors. They might not necessarily be epinephrine and norepinephrine, but they're still activating the alpha and beta adrenergic receptors. So they're going to cause sympathetic effects, so things like that increased heart rate where your heart starts beating faster. They're going to open up your airways. They're going to cause all the release of nutrients into your bloodstream. So things like amphetamines, pseudoephedrine, and MDMA. So yeah, so I know they include a lot of like the stimulants or even things like was it cocaine we mentioned during the neurotransmission stuff. So I didn't do this back when I was in my when I was in San Francisco and when I was in my younger days and I would go to the clubs with my friend. But it was always funny because you could tell who was on these type of drugs because, well, remember those pupils and what the sympathetic nervous system does to it? So dead giveaway, if their like pupils are super dilated, that's one giveaway. Another get dead giveaway is like if it's 40 degrees, it's an outdoor party, and a guy has his shirt off and he's sweating. Well, that's not normal, right? So again, it increases your metabolism. Sympathetic increases your sweat glands. So I'm like, yeah, he's definitely on something when he's like 40 degrees out. He's taking 40 degrees Fahrenheit for those of you who are used to Celsius. Yeah, so they looked fried. So that was one of my favorite pastimes. Like, oh yeah, he's definitely on something. So that's one that give away pupils, and yeah, they're way hotter than everyone else. Not necessarily in looks, but in body temperature. Okay, sympatholytic drugs. So lysis is a useful root word. So lysis referring to some sort breaking up something. So when you ever see something that has lysis, it means breaking up or like breaking down something. So these are adrenergic antagonists. They're going to break up the sympathetic effects. These are things that block adrenergic receptor activity. So they're going to reduce sympathetic activity, say, and indirectly promote parasympathetic effects. So if the parasympathetic system is in there in the background and the sympathetic is up here, if you give a sympatholytic, it's going to bring the parasympathetic to the forefront. So things like alpha and beta blockers, especially if you end up in the clinic, and beta blockers are actually very important for cardiovascular vascular use. Because the thing is that, well, what does the sympathetic nervous system do to the heart? It causes the heart to beat faster and stronger. But what if the heart is starting to beat at a fast rate that's not maintaining a constant rhythm? It's kind of like almost being inconsistent and irregular. Well, think about it this way. If you're running on a treadmill and you're running so fast that you're starting to stumble, do you want to increase the speed on the treadmill or do you want to decrease the speed so that you're able to catch up and maintain your gait? So you want to kind of slow things down. So this is one reason you might want to give a beta blocker to a patient. And hey, remember when we talked all the way back when I think it was like the facial bones in chapter 7? So we talked about decongestants and things like pseudoephedrine. Well, pseudofed is actually probably don't find this in over-the-counter drugs anymore. It's all phenylephrine. But what do they have in common? They're both alpha-1 adrenergic receptor agonists. So remember how I said alpha-1 receptors cause vasoconstriction? Well, it's going to relieve the blood pressure by cutting off blood vessels that lead to the sinuses. So this was why it feels like it's relieving the pressure. It's also going to reduce the mucus production through cutting off the shrinking and constricting the blood vessels as well. Now, I've probably seen this in movies, and what are they doing here? Well, they're taking you usually see them loading up some sort of mysterious chemical, putting in a needle, and then jamming into someone's heart. Now, why do they do that? They do that in the movies because there's someone's heart, they suffer cardiac arrest, their heart stopped, so they're going to try to start it up again. Or like this one right here. So adrenaline, remember adrenaline is the same thing as epinephrine. So it is a beta 1 agonist, and the beta 1, so this is the one I definitely want you to know. Actually, I think there is beta 1 and beta 2 on the heart, but for this class, know that beta 1 is the dominant adrenergic receptor on the heart. So if you're giving that epinephrine your body normally produces, but in a concentrated form, and giving it straight to the heart, what's it going to do? It's going to activate the sympathetic nervous system in the heart. It's going to cause the heart to increase the contractions and increase the heart rate. So again, if your heart stopped, you want to get starting again, right? So increasing the heart rate and stronger heart contractions. So that's what they're doing in this image right here. And then bronchoconstriction. So here we have like the bronchioles, the airways of that are leading to these things called alveoli. These are these actually little tiny sacs at the. So you notice that your lungs, the insides kind of look like a tree. So the fruit on the tree would be like these little alveoli, and that's actually where you exchange carbon dioxide and oxygen between your air and the blood. But that's more for next semester. What we have here is bronchoconstriction. So now the smooth muscle is causing your airways to shut off. So what happens if you start to shut a window? It starts to close off the flow of air in that window, right? Same with bronchoconstriction. If you start to constrict your bronchioles, it's going to slow the flow of air. Or if it's completely shut off, you're not going to have any airflow. So this is present in many diseases. Do not worry about which disease is at this point. So again, this is just illustrating many diseases can cause bronchoconstriction. So how can you reverse this? You might want to give something like salbutamol, also or albuterol, a trade name Ventolin. So this is a beta 2 agonist, and you find beta 2 adrenergic receptors on your lungs. I definitely want you to know that one. Beta 2 on your lungs. So usual mnemonic beta 1, well, how many hearts do you have? One heart, two lungs. So one heart, two lungs. So beta 2 on your lungs. So if you have beta 2 agonist, what is that going to do? It's going to cause sympathetic-like activity on your lungs. Think all the way back to the dual innervation slides we just covered. What does the sympathetic nervous system do to your lungs and airways? It causes them to dilate, right? Because again, remember during exercise, you want to breathe in more air. So if you give a beta 2 agonist, it's going to dilate the bronchioles and airways of your respiratory system, opening up your airways, thereby reversing that bronchoconstriction we had in those diseases. So this is why, like asthma inhalers, they often have beta 2 agonists to open up those airways so the person who needs the inhaler, rescue inhaler, can breathe again. So short acting because again, you don't want it permanently dilated when you don't need it.